Hi friends, my college name is Sanjuni Pratishthan College of Education at Kurun, Taluka Parner, District Ahmednagar. My name is Shubhangi Vilas Chavan and subject code is 212 and my subject name is Entrepreneurship Development and guidance teacher is Professor Kale sir. This subject under the 1 point the antimicrobial drug and this drug name is sulfone. The antimicrobial drug sulfone that include in uh, त्यामध्ये भरपूर पॉइंट्स इन्क्लूड आहेत त्या कंटेंट मध्ये. तर फर्स्ट आपण पाहूया antimicrobial drug, then introduction, second structure, and third mode of action, and fourth pharmacological action, and application, SAR, and adverse effect. आणि त्यामध्ये एक्झामसाठी विचारले जाणारे क्वेश्चन ही आपण पाहणार आहोत. The first of all, introduction. Then introduction. Sulfones are organosulfur compounds. Sulfones are SS dioxide of either and represented by general structure formula. Then sulfoneचा जनरल स्ट्रक्चर फॉर्म्युला आहे R-S and then ब्रॅकेट मध्ये O 2R. हा आहे sulfoneचा structural formula. Here R and -R are organic groups. त्याचे organic groups आहेत R and R-. Sulfones are wide range of chemically and biologically active molecules. Sulfones are widely used as solvent, polymers, and biopharmaceutical agent. Several drug molecules containing sulfone group are used for the treatment of leprosy and tuberculosis. Then त्याची यूज ही दिलेले आहेत. ओके. Then sulfoneचं स्ट्रक्चर. sulfoneचं स्ट्रक्चर पाहूया. A sulfone is a chemical compound containing a sulfonyl functional group attached to two carbon groups. म्हणजे सल्फोन हा केमिकल कंपाऊंडला दोन सल्फोनिल फंक्शनल ग्रुप अटॅच आहेत and two carbon groups. The central hexavalent sulfur atom is double bonded to each of two oxygen atoms and has a single bond to each of two carbon atoms. म्हणजे दोन ऑक्सिजन ॲटम अटॅच आहेत तर दोन कार्बन ॲटम्स अटॅच आहेत. This is the sulfone structure. And the second is mode of action. The sulfones are powerful biological antioxidants. They can replace by vitamin E, biological in fight rat state, pro-oxidant diet. Some of sulfonamides produce hypoglycemia. Example 5-isopropyl 2-sulfonamido and 1,2,3 lysoazole is a compound which produces effect in human which passes strong hypoglycemic activity without much antibacterial action. This discovery opened new chapter in treatment of diabetes. Sulfone have diuretic action of an kidney. Then sulfoneचे pharmacological action काय ते पाहू. Pharmacology action of sulfone containing compound. First, antibacterial. Second, antifungal. Third, antimalarial. Fourth, anti-HIV. Sixth, anti-proliferative. And 7, anti-cancer. And 8, thyroid receptor. Then first पाहूया sulfones antibacterial activity. Sulfoneची antibacterial activity. These compounds were evaluated for their antibacterial and antifungal activity and few sulfones derivatives. Kumar et al. Reported the efficient and selective oxidation and sulfite into sulfate sulfoxides and sulfones and their in vitro antibacterial activities against Bacillus cereus. Then त्यातलं पाहूया आपण leprosy. Leprosy, also known as Hansen disease, is a chronic infectious disease caused by Mycobacterium leprous. The treatment of mycobacterial infection with sulfones led to the demonstration that bromine exerted a favorable effect in rad leprosy. This was soon followed by successful treatment of leprosy patients, first with bromine and later with DDS म्हणजे diammonium sulfone. Then त्याचं स्ट्रक्चर पाहूया. Then structure 4,4-diammoniophenol sulfane. Then second पाहूया sulfones antimalarial activity. Antimalarial activity मध्ये the series of compounds show promising activity in malaria infected mice and were effectively and selectively cytotoxic to cancer cell lines. The antimalarial activity of sulfones show that DDS could clear the blood of tryphozoites of both Plasmodium falciparum and malaria. And third पाहूया sulfones anti-inflammatory activity. In comparison to alkyl into analogous, the corresponding alkyl sulfones derivative were reported as more potent anti-inflammatory analgesic agent. Sulfones absorption, metabolism and exertion. Absorption. Most of the sulfones are well absorbed, mainly from the small intestine, slightly from large intestine, and insignificantly from the stomach. Metabolism. Metabolism of sulfonamide involve mainly N4 acetylation and exertion. Exertion of sulfone occurs through kidney. सल्फोनचे काही ऍप्लिकेशन आहेत तर सॉल्व्हंट, पॉलिमर, फार्माकोलॉजी. ते ऍप्लिकेशन पाहूया. फर्स्ट ऑफ ऑल सॉल्व्हंट. Sulfonen used to extract valuable aromatic compound from petroleum. And second, polymer. Same polymers containing sulfone groups, biphenyls and 4,4-dichlorodiphenyl sulfone. And third, pharmacology. Sulfones are pharmacology include dapsone, a drug formerly used as an antibiotic to treat leprosy. And त्याचे इफेक्ट पाहूया. ॲडवर्स इफेक्ट दी sulfone. The most serious side effects of sulfonamides are their action on the bone marrow. Serious type of blood have been reported including leukopenia and agranulocytosis, aplastic anemia and thrombocytopenia. sulfone साठी काही क्वेश्चन आहेत एक्झाम साठी क्वेश्चन. फर्स्ट क्वेश्चन, what are the sulfones and explain their mode of action. Second question, discuss in brief antifungal agent and selective toxicity. Then lastly, the point is thank you so much.